And I'm delighted to introduce Michele Acton from the Chief Executive of Fight for Sight, who is going to give us a peek into peak.
Thank you very much. Gosh, thank you very much. Hugely inspiring to be here today and to hear all of the sort of stories and examples. And I've been asked to speak today about PEAK. PEAK actually stands for Portable Eye Examination Kit. And the story about PEAK is actually a story about how a UK medical research charity, I'm going to put that just over there, a UK medical research charity without huge spend, but working with a truly driven and entrepreneurial ophthalmologist can really have significant impact on a global scale. But before I tell the story, I'd just like to ask everyone here to put your hand up if you've had an eye test in the last 2 years. Wow, that's a great audience, not normally the kind of response that I get. But what that means is that pretty much everybody here has actually experienced how easy it is to have and to be able to access an eye test. Because of course the point is we all can and we all should be having eye tests regularly. Because sight loss is a global health issue. There are 285 million people estimated to be visually impaired in the world. 39 million of those are blind. And the vast majority of people who are visually impaired live in low-income settings. They're over the age of 50. But the reality is that 80% of sight loss globally can be prevented or cured. And the gateway to treatment, of course, is an eye test. Because an eye test isn't just about whether you need glasses for the first time or whether you need to change your prescription. An eye test can also detect eye diseases like cataract, glaucoma, macular degeneration, diabetic eye disease as well. But the problem is millions of people worldwide simply don't have access to eye tests. And this was a particular problem for a research study when we were trying to establish the incidence and progression of eye disease in Kenya. And back in 2007-8, a population-based survey was undertaken in Nakuru in Kenya. It was the first such study in sub-Saharan Africa. And 4,381 people of 50 and above were actually recruited to this study and their eyes were tested. Now, 6 years later, Fight for Sight, working with the Medical Research Council, awarded a clinical research training fellowship to an ophthalmologist called Dr. Andrew Bastrus. And this enabled him to move to Kenya to undertake a follow-up study. But it was going to be very hard because he had to track down the same participants. And they had dispersed to over 100 different, mainly rural, remote locations. Most of those locations had no electricity and very difficult transport to get there. And so what he realised, of course, very early on, before he went to Kenya, was that transporting all of that delicate, expensive eye test equipment, which you've all seen probably in the high street, is actually a complete nightmare. And so this is what sparked the idea of PEAK. And a lot of thought went into what would actually make a successful portable eye examination kit. It clearly had to be simple to use, with simple to use tests that can be applied in any setting. It couldn't be language specific, for example. He obviously didn't want to transport large equipment. And he realised that actually, very early on, that the best way would actually be through developing smartphone apps and hardware. If you look now, penetration of mobile phones in Kenya is over 90%, smartphone take-up 44%, and massively on the increase. That obviously seemed like the right way to go. It had to be equipment that was capable of being really very rigorously validated. No point in developing substandard eye equipment that came nowhere near to the standard of conventional eye test equipment. And it had to be capable of being used by non-specialist users. There aren't the people trained to actually apply eye tests in developing countries. So it had to be capable of being used by general healthcare workers and by teachers as well. And it was really clear that there's one thing to develop apps, there's one thing to develop hardware, but particularly if you're working in developing countries, if they're not linked to systems that you can diagnose, but if there isn't a treatment pathway, all you have is a diagnosis. And so from the start, it was very clear that before anything was developed, there were a set of criteria that were very much focused on the impact that actually we wanted to make. And the solution was actually Peak, which, as it is today, is actually a series of smartphone apps, hardware, and systems. There are a number of different apps which you can download onto your phone, which actually replicate some of those tests that you will have had when you've had an eye test in the high street. It's just that they're done on a smartphone. They've also developed some hardware, and what they've developed is an adapter that actually attaches to the mobile phone and can now take a photograph of the inside of the back of the eye, the retina, so that actually, which is crucial if you're going to actually diagnose conditions like macular degeneration and diabetic eye disease. But what the team that Andrew has now built up, which includes software engineers, hardware developers, and ophthalmologists and people who understand about training in health systems, they've actually really focused on developing the systems that will actually enable data to be captured so that people can actually get into a treatment pathway. This is just a photo of peak acuity. Peak acuity is a test which will just test how much you can actually see being administered in Kenya. And the way peak acuity works is it uses an E shape because we didn't want to use alphabet letters. So we use what's called a tumbling E, which points in different directions and it changes size as well. So the patient is asked to show you which direction they think the E is pointing in. And then the person who is administering the test will swipe the phone in the way that the patient has answered. And so within the app, it will then work out whether the patient has got that one right and all of the other tests right as well. And this is the adapter which can go onto the phone, which can take retinal photographs. Absolutely crucial in diagnosing eye disease. And these photos at the moment need to be beamed to somebody somewhere in the world, it can be done anywhere, who is trained to actually read retinal photographs and diagnose disease. And this is actually the adapter that's been made. It's taken a while to get this right, and that has been one of the things that has taken a bit of time. But the team are now confident that this adapter is the right way forward. So I'm sorry, it's a slightly busy slide here, but I just really wanted to talk about what the results were so far. Peak acuity, which is the tumbling E program, which can test what you can actually see, that was validated when Andrew was living in Kenya. They actually looked at that against conventional equipment, and it's accurate and it's efficient. So peak acuity, so now we heard about medical devices, it's been certified as a medical device in UK and Ireland. It's now being used in 90 countries, and you can download it now from Google Play Store. Peak Retina, which is the adapter, the piece of hardware to take photos of the retina, that's actually being launched in March 2017. And again, Andrew validated that when he was in Kenya by looking at the photographs it took compared to conventional equipment and getting those independently graded at Moorfields. And it's now actually already starting to be used for diabetic retinopathy screening, and not that this was necessarily one that we set out to do, but malaria retinopathy as well. Screening programs are also starting and are being trialled now in Kenya, Botswana and India. And in the schools programme, 80,000 children have now been screened, and we expect 300,000 to be screened in 2017. And the community screening projects are also being trialled as well. A new charity has been set up, the Peak Vision Foundation, because actually all of this is going to be run as a not-for-profit going forward. So just to talk about money and actually how it got to where it's got to, we very much see ourselves as a charity that are fairly early stage, and we want to leverage other funders. We raise about £4.5 million a year. We don't have the funding to actually take things necessarily all the way through. But actually what we want to be able to do is to be involved in sparking the ideas and funding at the early stage. And you can see from this chart that actually we spent £207,000 jointly with the Medical Research Council on the Clinical Research Training Fellowship for Andrew to go to Kenya, where he was able to use his time there to validate both peak acuity and peak retina. But then the most amazing thing about all of this is just the wonderful awards that Andrew has gone on to win. He's actually won £330,000 worth of prize money, which he's reinvested back into Peak. The awards include he's become a TED Fellow, he's done a great TED Talk if you want to catch that. He's won the Mazda Rebels with a Cause Prize, a Gifted Citizen Prize, Index Design for Life. Google actually gave him one as part of the Digital Top 50 Awards, and he's just won the Rolex Award for Enterprise as well. And also within the new charity that's been created, they've raised 2.4 million now, separately from us, completely independently from us now, 2.4 million into Peak Vision Foundation. And what they are aiming to do with the Peak Vision Foundation is for everything that they sell in terms of the hardware is to actually plough all of those funds back into supporting eye care in low and middle income countries. I mentioned that Andrew had won the Rolex Award for Enterprise, and I just thought you might like to just see the video that was prepared for that competition.
There's about 39 million people in the world who are blind. 90% of those are living in countries like Kenya.
Yes?
80% of them are blind from diseases that we already know how to cure or prevent.
Can everybody write all you can see on the blackboard?
I still can't believe we're in a world where we've already worked out how to provide most of the treatment, and it's still not happening. That felt deeply unfair. I made a decision in my late teens that I wanted to become an eye surgeon. Growing up in the UK, I felt both angry and guilty for having what I did have and for other people not having it. 2012, my wife and my son and I moved to Kenya to give something back. Most of the resources for eye care are in big towns and cities. Most of the patients who need access to that are out in more rural areas. So you have this big gap between where provision is and where people who need it are. One of the options is you take the equipment to the community, and that's what we tried to do. All of this heavy, very sensitive equipment, over £100,000 worth of kit, and a team of 15 people, putting it in the back of a van, going on non-tarmac roads to places with no electricity. The impact we were having was still very, very small, and something was going to have to change. Then I thought, it must be possible to recreate all of these tests I'm doing in the clinic, but doing it on a smartphone. Vision testing in itself is quite complex. The idea is to simplify the process so much that anyone can do the test. So in 2 to 3 minutes, I can teach you how to deliver this test anywhere on anyone. And this device here allows you to look inside the eye with the phone. And look how sharp the detail is. That was maybe 30 seconds, and he's already now getting a view of the retina. We don't think of ourselves as a technology company. Everything that we do is built on good people. Teachers in schools, healthcare workers out in the community. They can use a test which will provide accurate, reliable, objective results and share that with the specialist who can make the decision as to whether or not they need to come for treatment. Brian and his grandmother live just the two of them together and are completely dependent on one another, yet neither of them can see. The leading cause of blindness is cataract. By putting an artificial lens in, you can restore sight overnight.
How many fingers?
That too.
They are able to see. They'll be able to see their children, their animals. Today they are going home, they'll see the food they're eating.
There'll always be more to do. We've had requests that would amount to 10 million children being screened if we had the capacity to deliver that. So we're setting out now to put up a building near the eye unit where people from all over the world can come to learn how to run the programs and take that into the communities that they're working in. The thing that keeps me up at night is knowing there's still queues of patients everywhere. I want to see that change.
The future. What does the future hold for PEEK? Well, I think we believe that actually there will be global use of PEEK Acuity and PEEK Retina. And it's not just for developing countries, actually. Just think about the difference it could make here. The people in care homes, people who are housebound, who will actually be able to get a really accurate eye exam at home or in their care home. In the future, the team actually wants to deliver new tests, new apps, and develop new hardware. And standing here in Google DeepMind today, I mentioned earlier that actually the retinal photographs get beamed for humans to read them and diagnose eye disease as a result. Just imagine, as Google DeepMind technology increases, and actually you can have a diagnosis through machine learning. And just imagine if that technology can be built into your smartphone for an immediate diagnosis. The future will be utterly revolutionised for diagnosing eye disease. Andrew mentioned this building of a training centre. It is all about scale. It is all about actually being able to partner with people and actually deliver these sort of eye tests, enabling people to get into systems, but to do it at scale. And I just think as more partnerships are developed and more partners are able to access these apps, this hardware, the understanding of the systems, just think how many more lives will really be transformed. Thank you.